Hi everyone. Welcome back to the channel. If you're a senior here in the US looking to support your liver health, especially if you've had past alcohol use or are concerned about liver damage, then today's video is for you. We're going to talk about 4 of the best natural strategies to detox your liver, reverse alcohol-related damage, and restore vitality. These tips are backed by research, and they work even for older adults. Welcome friends to your channel Be Healthy Talks. Please press the subscribe button and turn on the notifications. All these information are science-backed and research references are provided in the description below. Let's dive in. The most important first step is full abstinence from alcohol. Research shows that when you stop drinking, your liver begins to repair itself. Fat accumulation goes down, inflammation decreases, and metabolic pathways normalize. One major study found that even heavy alcohol-fed mice began reversing liver injury and improving enzyme levels after just 1 week of abstinence. For seniors, this matters even more, because age adds other stresses on the liver such as medications and slower metabolism. So make quitting drinking your cornerstone strategy. Without that, other steps will have limited effect. Even if alcohol was part of your past, stopping now gives your liver a chance to heal. Think of it as giving your liver the rest it needs so it can rebuild. It's never too late for the liver to recover. The damage is more reversible than many people think. Next up is your diet, eating to support liver repair and reduce inflammation. The liver is the body's detox organ, but it still needs good building blocks. According to the Cleveland Clinic, nutrition therapy is the most evidence-based and most important intervention aside from stopping drinking. Here are the key dietary highlights for seniors wanting liver support. Choose a Mediterranean-style diet with plenty of vegetables, whole grains, lean protein like fish and poultry, and healthy fats such as olive oil and nuts. Emphasize cruciferous vegetables like broccoli, Brussels sprouts, and cabbage, which contain compounds that support the liver's detoxification systems. Avoid processed foods, foods high in saturated fat, and excessive sugar, which stress the liver further. Stay hydrated and get adequate protein, especially important for seniors, whose liver may already be under extra strain. Your liver needs fuel to rebuild. It's not about a flashy detox shake, it's about consistent, good food. For older adults, that means smaller portions but higher nutrient density. When you eat inflammation-reducing foods, you're helping your liver to repair instead of staying in damage mode. Another powerful way to support liver health is to care for your gut. Research shows the gut and liver are tightly connected, something scientists call the gut-liver axis. In older adults, this connection is even more relevant because gut microbiome diversity tends to decline with age. Supporting gut health helps reduce liver inflammation and stress. You can do this by including probiotic-rich foods or speaking with your doctor about evidence-based probiotic supplements. Studies suggest probiotics can modulate inflammation in the gut-liver pathway and may slow the progression of alcohol-associated liver disease. Eat fiber-rich prebiotic foods such as whole grains, legumes, and vegetables, which feed beneficial gut bacteria. And avoid unnecessary medications or toxins that further disrupt gut or liver health. Think of your gut as a friend to your liver. When the gut is healthy, your liver gets less stress. Especially for seniors, a few good bites of fermented foods or a gut health focus can go a long way. The next step is movement, maintaining a healthy weight, and ensuring your nutrient balance. Regular physical activity helps reduce liver fat, lowers inflammation, and improves metabolic health. Even walking, swimming, or light strength training can make a big difference. Maintaining a healthy weight is especially critical, because excess body fat, especially around the belly, adds extra strain to the liver, whether or not alcohol was the original cause. Micronutrients also play an important role. Zinc deficiency is common in alcohol-related liver disease, and research shows that zinc supplementation can enhance liver regeneration. For seniors, movement doesn't mean heavy gym work, it means consistency. Aim for 20 to 30 minutes of walking most days, some light resistance training, and regular stretching. A healthy weight can relieve the liver's burden and make your diet and abstinence strategies even more effective. Also, ask your doctor about your vitamin and mineral status. Zinc, B vitamins, and others may need attention after years of alcohol use. So to recap. Number 1. Stop all alcohol and commit to abstinence. Number 2. Follow an anti-inflammatory, nutrient-rich diet that supports liver repair. Number 3. Support your gut-liver axis with probiotics and fiber-rich foods. Number 4. Stay active, control your weight, and optimize key nutrients like zinc. If you're a senior and conscious about your liver health, these strategies give you a real chance to reverse early to moderate alcohol-related liver damage, improve your health, and regain vitality. Of course, always check with your healthcare provider before making major changes, especially if you have diagnosed liver disease or other medical conditions. If you found this video helpful, please give a like, share it with someone who might benefit, and leave a comment below. Which one of these 4 strategies are you going to start with this week? Thanks for watching, please subscribe, and I'll see you in the next video.